Hello everyone and welcome to Inside Healthcare. During the holiday season, stress and depression can ruin your holidays and to even take a toll on your health. In this program we'll have some practical tips to help you cope, and we're very pleased to have with us Lee Stern-Atumala, a lead psychotherapist with the Healthiest Outpatient Mental Health and Addiction Medicine. Thank you, Lee, for joining us.
Thank you for having me.
Appreciate it. I know it's a very busy time for everyone, especially you too, so thank you. So what are you seeing with your patients and your clients?
Well, I think, first of all, I want to just say people are tremendously resilient and they cope with stress pretty well. Over the holidays, however, stress can really build up and create problems for folks. Usually, though, we don't see them coming into our clinic as new patients until the holidays are over and they realize that, wow, I really did struggle through that and could use some help in managing my symptoms. Current patients, however, do report additional symptoms or an increase in symptoms, and we often hear patients say things like, I just want it to be over, or I could just skip it. So we help a lot of our existing patients kind of cope with their symptoms that have increased over the holidays.
And do you see stress more than depression, or are they hand in hand?
Well, I should say stress is a normal reaction that we have to any pressure that is put onto us to find some way of coping or to get the job done, if you will. So some stress is good, but when stress becomes to a level that's unmanageable for you, then, and it's different for everybody, then you can begin to have symptoms such as anxiety or depression or both. And typically this time of the year we see more depression than we see anxiety.
And it's not just caused by external things. I mean, there's a physiological reason also that we see an increase.
This time of the year, one of the things that people see is something called seasonal affective disorder, or SAD, appropriately named. And it shows up right about the same time as the holidays because that's when our sunlight decreases and the weather gets colder. So it's, you know, the decrease in sunlight has an impact physiologically on the chemical reactions in our brain, which then can cause depression. Seasonal affective disorder is treatable. Sometimes it's a matter of going under fluorescent light, or maybe you can get a phototherapy light that your doctor can prescribe for you to help you overcome those symptoms. And there's also some medication that you can take, an antidepressant, to help you.
And especially in this part of the country too, there's
in Minnesota,
a deficiency of vitamin
yes.
D, which also can contribute to this.
Absolutely. Minnesotans, and if you're from Wisconsin, North Dakota, South Dakota, not to leave those folks out, the cold weather where we have shorter days in the winter, we do naturally see people, I shouldn't say naturally, I'm sorry, people have a natural tendency to have low levels of vitamin D, and they should probably check with their physician to have those levels checked. When levels of vitamin D are low, we can also experience symptoms of depression. Sometimes those symptoms caused by seasonal affective disorder and low vitamin D are fatigue. We're more sleepy than usual, we're more irritable than usual, and we don't spring back as quickly, so our resilience is tested.
Oh, okay.
So then we do become, over the holidays, more prone to having more difficulty with the added stress of planning for holiday seasons.
And the holidays of themselves can cause both of these.
Well, the holidays present a problem for many people because we have a tendency to look back over all of our past holidays and remember holidays from our childhood that were wonderful and filled with awe. And of course, we've built them up to be bigger than they are. And we simply can't compete with those memories. So a good rule of thumb is to build your own new memories and stay present or stay current in the current holiday. The holidays for some people aren't happy because they're lonely. Maybe they've recently lost someone close to them.
As we were talking before we started taping, that both of us have lost loved ones.
And it becomes harder because we miss that person and we start remembering that person and what that person was like to celebrate the holidays with. So it just kind of adds to that grief. And even though you may have lost your loved one 2, 3, 4, 5 years ago, you still have some residual grief that comes back over special occasions, especially around the holidays. Yeah.
And then there's always trying to do too much, maybe. And then there's also financial sometimes problems that can rise.
I think the main reasons that people become depressed over the holidays is unrealistic expectation, financial pressure, pressure to be happy and to be merry.
When they may not feel
when
like
they may
it.
not feel like it. And it's everywhere. Everywhere you go, everybody's happy. And social media has not been our friend when it comes to being realistic about what we should expect of ourselves and our loved ones. Social media depicts the best of people and the best of people's lives when that may not always be the reality. So we try to compete. And we overschedule ourselves on the holiday. There's lots of special parties and events and gift wrapping and shopping and cookie baking, and we try to cram that all into, what, a month? And that's not much time to do all of those things. So we expect a lot of out of ourselves, and we don't always remember to stop and take care of ourselves, especially during this time, so that we can continue to be resilient and use our natural coping skills.
So what would be some of those practical tips, coping skills that could help people get through the next few weeks, the next couple of months?
Make realistic expectations for the holidays. Set realistic goals. Don't expect yourself to do extraordinary things that you can't do. If you're working and you have children, don't expect that you're going to have those cookies all baked and 200 dozen cookies that you're going to give away at cookie fairs or do for cookie exchanges. Don't expect to attend every party that you're invited to, or give yourself a break and set really realistic goals for yourself and your family.
What would be realistic? I mean, how do you know what's realistic goals?
Well, I think because of the way you feel. If you start to feel pressured, if you start to say, oh, I wish I didn't have to go, I don't know how I'm going to get it done, and you're getting up, you're losing sleep, you're getting up too early, you're going to bed too late, and you start to feel the symptoms, and maybe you're reaching a little bit too much for the ibuprofen bottle, or maybe you're drinking a little too much wine. Those are all indications that you need to really step back and take a look at what you're doing in your lives. And I think it's important to prioritize. What exactly is it? What is your goals? What are your morals, your values? What's important to you? And stick with that and leave the rest out.
What would be some other coping skills?
Big thing is keeping track of holiday spending. Know how much you can afford and how much you can spend, and don't try to compete with others. Give from your heart. Sometimes a simple gift that you've picked out special for your friend or your loved one means more than something that's going to cost a lot of money. So really decide, how much can I afford, and leave it at that. If you're lonely, reach out to some old friends that maybe you've lost touch with. Go out, find a way to make new friends. Attend your local church if that's what your inclination is. Do some volunteer work. There's all kinds of opportunities.
I know that always feels really good.
Yep. Not only do you lose some of the lonely feeling, but you feel good in helping others. Of course, limit your consumption of alcohol, because that will increase your depression. Alcohol is a natural depressant, so we don't want to add that on top of already having the holiday blues or seasonal affective disorder. And then if you've recently lost a loved one, try something new. Hang on to those old traditions. They're important, but try something new. Build a new memory, a new tradition just for yourself that you can carry forward. And then important too, that I find with my existing clients, they have such small support systems. Build your support system. Reach out to those support systems that you already have in your life. Again, your faith community, your clubs, your friends, your work peers. Reach out to those folks to help you through stressful times.
You're always welcomed, I would think.
Yeah. Sometimes we just need, if symptoms become so severe, then we do need counseling. We do need to reach out. Maybe there's some support groups that you can join, or call a local mental health agency to meet with someone for some counseling to help you through.
What about, I know personally, when I exercise, I feel good. Nothing can bother me. And like today, I did a nice 5K walk before I came here. So
I'm glad you mentioned that, because exercise, I always like to say, it's like medicine. You can get out for a good walk in the morning, the rest of your day seems to go much better. Even at the end of the day, exercise, they used to say don't exercise before bed. They now know that's probably not true. You're probably okay with some walking or going on the treadmill or something like that. This weather, I don't walk outside.
Well, I don't either.
Yeah.
I was walking inside a dome today, yes.
Yep, going to the gym is a great way.
Yes.
Or even going to the mall and walking up and down.
It's free.
That's free, yep. It's great to restart your nervous system and get those natural endorphins moving.
And what about diet, too? It seems like there's so many sweets and high-fat foods.
And we want to enjoy the holidays, don't we? We want to enjoy those special little treats that we only have over the holidays. But try to limit those. Again, that's setting those realistic goals and keeping your priorities straight. What can I do? What can I have? What can I enjoy? What can I indulge in? Without going overboard so that you later develop, maybe, gaining 5 pounds isn't a big deal for some, but for a lot of us, gaining 5 pounds can add more stress. And add more depression, and add more health issues later on. I want to talk a little bit about when you should seek professional help, and I think what you'll notice is your natural resilience gets lower. You'll find yourself, like I had mentioned earlier, feeling more fatigued. Maybe you're not able to do all of the things in the day that you should be doing. You're not eating right, you're not sleeping. Those are kind of symptoms that we probably need to seek some additional help.
And then there are resources in the community.
There are. A good place to start is your primary care physician. If you have a Health East primary care physician, he or she can refer you directly into one of our mental health therapists who are open right now to take new patients, many of them. So within a week you could be seen by a therapist to just help you 1 or 2 sessions get through this difficult time for you.
Mm-hmm. And then there's others throughout the community as well.
There are. I think, again, starting with your primary care physician, asking for a referral. You could also call your insurance company, your health care coverage, and ask them who would be a good referral for you that's covered under your health care plan. So.
Final comments and advice for our viewers.
I think, if you feel like you're having a mental health crisis, that's a very serious condition where if you feel like you might harm yourself or someone else, that's serious. Not any more typical this time of the year. I want to point that out because I think that's a myth than it is any other time. I think the important thing to remember is the holidays are a special time. Make it special for you. Make it count for you. Sit back and enjoy. Don't overdo and be good to yourself.
Oh, yeah. Great advice. Thank you, Lee.
Thank you for having me.
Really appreciate it.
Thanks.
So thank you. We're going to take a short break, and when we come back, we're going to have some important information about preventing falls in your home and in your neighborhood. Stay with us, everyone.
A promise was made, a promise that hit the beaches of Normandy, a vow that captured Iwo Jima, a contract that weathered Tet, a pledge that stormed the desert in Iraq, an IOU that braved IEDs in Kandahar. A promise was made to America's veterans. DAV fights to keep that promise, so all veterans and their families get the benefits and support they earned. For help, visit DAV.org.
Mom was diagnosed with Alzheimer's at 58 years old.
For me, it was heart-wrenching.
It takes a toll on everyone. I mean, it's a depressing disease to watch unfold before your eyes.
You just don't see the person's soul is like gone.
This disease just ravages a family.
It changes your life.
The magnitude of it is indescribable.
Now is the moment. If we work together, we can stop this epidemic.
Contact Bright Focus and learn more.
You still texting?
Is this a real morgue?
Yep.
Shut up. Like with real dead people. Ooh, I gotta text Ashley.
Ashley identified you when you wrapped your car around that light pole, because you was caring more about that thing than the road.
I knew she liked me.
Not anymore.
There's a reason it's illegal to text and access the web while driving.
Welcome back to Inside Healthcare. We have a quick update on the Dragon Divas who were with us earlier this summer. They finished their season with a great ending. They are the local breast cancer survivors who compete in Dragon boat races, and at the final international race of the year in Florida, out of 101 boats, their Courage group placed 31st, and their Hope group came in 62nd. Now, those may not sound like great numbers, but 4 years ago at that very same international race, the Dragon Divas came in dead last. So congratulations to these remarkable local women. And if you're a breast cancer survivor, you're welcome to join the Dragon Divas. You can find out more information about them on their website. Now we turn our attention to what's being done in the community to prevent a very serious health issue that could pose a threat to you or your loved one. We're talking about falls, and to tell us about it is Marcia Hughes, Health East Director of Community Health Improvements. So Marcia, thank you for coming back. You've been here, I guess, many other times with us, so thank you.
Thank you, Jody, for having me.
So I understand that falls are a very serious problem, affecting thousands of people.
Yes, and it's getting more and more attention because they realize the impact of falls. So they understand that a third to a half of older adults fear falling. And just the fear of falling can increase our risk for a fall. It also adds to social isolation and depression. And there's about 40% of people that are 65 and over that do have a fall every year. So it's a significant, problem.
And here in Minnesota as well, or the upper Midwest, or just Minnesota, and it's not what you think. It's not necessarily related to the ice, snow, cold winter.
Well, and as it turns out, Minnesota ranks 5th in the nation for deaths related to falls, which is not related to the cold and snowy conditions that you might assume. There is some speculation on what that problem is, and one of my colleagues is Dave Fink, and this is his perspective, and he works for the Metropolitan Area Agency on Aging, and they're a sponsor with our Matter of Balance program. But the speculation is that in the winter, when it's cold, we tend to stay inside more, we're less active, we're not using our muscles, and that does put us at a greater risk then for a fall when the weather does get a little bit nicer and then we get out. And so there's that speculation makes some sense to me.
So tell us about this program. It's in the community, A Matter of Balance. What's it all about?
Well, the Matter of Balance, it's an evidence-based program, and what that means is that there's been some research done to say, you know, when people go through this program, they actually can reduce their rate of falling and reduce their fear of falling, which is probably just as important as, you know, actually falling itself. And so Health East is one of the partners with the Metropolitan Area Agency on Aging, and we are offering the Matter of Balance program in the community. This is an 8-week program, and we meet for 2 hours once a week, and we talk about our risk of falling and our fear of falling. And it's very interesting, Jody, most of the participants in the program, when they get to know their group a little bit, usually the 3rd or 4th session, they really start to open up and share about the realities of their fears of falling. And many of them have actually had a fall, and they don't always report it. And for fear of, they don't tell their children or their doctor, and you know, they're fearful of maybe their family members or their physician will think, well, they're getting more frail and they shouldn't stay at home.
Wow.
So that fear, then it's not reported. And so when people do have a fall, they don't report it, and they're worried about having another one. What happens to us? We just become less active. And so that puts us at greater risk for falling because we're not as strong and flexible. And so it's really kind of a vicious cycle. So we're really trying to bring more attention to the resources that are available for people. And so during this Matter of Balance program, we talk a lot about being safe at home and different things to do at home to keep your environment safer from a fall.
Which would be some of those, what would be some of those
well,
things?
Here's kind of a typical scenario where the person is sitting in a chair with a cat in the lap, and the phone rings, and for some reason we feel this urgency to get the phone, and we all feel that way, and we talk about this in the group. Why do we feel so? Why is there that urgency, and what can we do to think twice about that and and do some things to change our environment so that we're not running to the phone. So
because when they get up and run to the phone, they fall.
Yeah, and their cat falls off the lap, and then maybe they trip over their pets,
Wow.
which is also very common to trip over a pet. Now, we're not suggesting to not have your pets around, but there are certain things that we have to be very, very careful of. Another problem at home is scatter rugs. And I have a situation where we worked with one of the participants that had a scatter rug because she had this brand new beautiful carpet, but she was tripping over the scatter rug, and she admitted it to the group, and the group said, well, one of the exercises in the Matter of Balance class is to think about the cost benefit. So we said, well, if you have a fall, think of what that's going to, with an injury, it's probably going to be an ambulance ride, it's going to be an emergency room visit, surgery if there's a hip that's broken or fractured, there's a hospital stay, which can lead to then some long-term rehab. So when you think about that versus, well, if I have to replace my carpet in a couple of years, it's a lot less expensive and a lot less on my physical being. So the program is really very positive and upbeat, and just raising our awareness of all the risks we have for falls. And it can happen at every age. And just because we're getting older, it doesn't mean that it's inevitable that we're going to have a fall, because they are preventable. And one of the pieces in the Matter of Balance program is to increase our physical activity. And so part of the program, we actually have about 40 minutes of exercises just from chairs, or
is there something
hang on
that
to,
you could kind of show us?
even there is one just to help to keep our wrist flexible.
Oh,
just so
like
you
that?
can do this while you're watching TV or
talking on a show.
This motion, there's a lot with the ankles, because it's important to keep our ankles flexible to manage the terrain that's uneven, especially in Minnesota. And we had so part of the really important piece of this is to stay physically active in a safe environment. And so we encourage people to do these exercises between the classes, and then when the class is over, to make sure that they're continuing the exercises at home. It's really important.
I sat in on one of the sessions, and the nurse was talking about even one that you can just do while you're in the bed before you even get up in the morning, just kind of what you're talking about, moving that ankle.
Yes.
Just kind of turning it one way, then the other way, and then doing the other one before you even get out of the bed. So
yeah, and Jody, even to sit, even if it's in the middle of the night and you're going to the bathroom, this is a typical situation where people fall. Make sure it's well lit. And then even to sit along the bedside for just 10-15 seconds
before they get up.
Before you get up.
That's good.
So
advice.
even from sitting to standing positions, if you're realizing that you're going to be changing your positions, just be very thoughtful, be very mindful about changing positions, and that's a good one, not only for the ankles on the bedside, but just to sit there for a few seconds.
How does medication fit into all of this?
Thank you for bringing that up.
Might be on medications.
Medication. There's a lot of medications that can affect balance. So we really encourage people to talk to their doctor, especially if they have a new medication and have they're lightheaded. Sleep medications can definitely cause a risk of falls. There's some diabetes medications that can cause hypoglycemia, puts us at a risk for a fall. So if you have any of those symptoms, especially with a newer medication, talk to your pharmacist or your physician. The other thing is vision. Glasses. If your glasses aren't properly fit, that can be a real problem for increasing your risk for a fall. So the medication and glasses are really important pieces.
So how does someone find out about how they can maybe
So we do
participate
in
in one of these programs?
In the White Bear area, we are offering a class starting January 14th. That's going to be offered in the afternoon. It's a 2-hour, 1:30 to 3:30 at the Serenity Senior Care. So we would invite people to inquire about that. I believe that my phone number will be on the screen, and so I can make sure to give people the proper information on how to register and get involved in the program. And we will be offering several other programs this spring, starting in February. So if anyone is interested and want a little bit more information about a program that might be in your area. And the northern part of the city, and also Cottage Grove and
What about cost for the program?
There's a $25 cost for the program.
That seems reasonable.
It's reasonable, and you get there's a workbook that goes with it, which includes a lot of the exercises that we do. There's 2 coaches that are each session, and there is scholarship money available if that's not affordable for someone.
I understand too that you're expanding this to other populations as well in the community.
Yes, we did offer this at the Hmong American Partnership, and so we provided this. It's all, of course, in English, but we had to do the class for people that don't speak English. They were speaking Cambodian and Vietnamese and Hmong. So we actually had quite a bit of fun with that because we acted out several things, and we had to bring in quite a few props to describe the situations at home that might be more hazardous. And it's very interesting. We're all human beings, and every population that we worked with, they all worry about falling, and they do not share the problems that they're having at home.
Final word on preventing falls in the community and at your home and things like that.
Yeah, being very mindful of your surroundings, not being in a hurry, and asking for help is really, really important. One of the pieces that we talk about is being more assertive and really identifying where you need help. And neighbors, kids, through our faith communities, there's lots of people that are very, very willing and interested in helping us. So,
and your number again
is 651-232-5444.
So if they have any questions about preventing the matter of balance, preventing falls.
Yes, and also on the screen too is our website, and we do direct people to, there is a falls risk assessment that if they're just kind of wondering if they may be at risk for a fall, we do have a risk assessment that's also on our website.
Well, great information, Marcia.
Thanks,
Always
Jody.
glad to have you with us, so thank you.
Appreciate it, thank you.
Thank you. And we'd like to thank you for joining us. We hope you can join us here next month on Inside Healthcare. See you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.